Hello, everyone. My name is Dan Toner. I'm the health insurance broker for Brave Wings Therapy, and I'm here to talk about the open enrollment. Our health plan renews every June, so we're going to open enrollment up in the next few weeks to give you time to go into our portal and make your elections for this upcoming renewal. On the screen, you're seeing a memo that we put together, and with the help of Crystal, we hand this out every year. If you go to the last page, you'll see my company, FFP, and that's me, Dan, and my support team, Amanda, Leslie, Chris Graziano, separate conversation. He handles the IRA retirement plan. He's out of our Bayonne office, but today is about the medical that my team in Hazlitt takes care of. So just going back to the memo, this obviously can be used for if you're a new hire during the year. There is a waiting period. You're covered first of the month following your date of hire. You have to work 30 or more hours a week to be eligible. This is explaining if you waive coverage, you need a qualifying event to come on prior to each June's renewal. And starting in June, we're going to maintain some good news here. We're not changing any of the coverages. So we're offering the two different plans, the $3,000 and the $1,500 hospital and surgery deductible. We're offering the same plans from Guardian. So there's not too much changes. You will probably remain on the same plan, but we do want you to go into the portal and re-elect coverage. You can waive or enroll, but we need everybody to go in and make their elections. In terms of the medical plans, you'll see a lot of identical coverage. Primary care, there's a $35 copay for your primary and a $75 copay for specialist. On the richer plan, the $1,500, the copay goes down $10. The urgent care copay is the same on both plans. The prescription benefit is the same. And the way that works, by the way, is you will pay a $10 copay for generic. And if you need, there are some preferred generics at $3, but most of your generics will be a $10 copay for a 30-day supply. And you'll have a $45 or $75 copay for what's called preferred name or non-preferred name brand. Specialty drugs, the ones that are super expensive, you owe 20% up to a $250 cap each month. So really it's a 10, 45, 75 program, and both are identical. The major difference between the two plans is you will pay a higher premium to be on the $1,500 because you're paying less of a deductible for things like hospital, surgery, and imaging, like an MRI, CAT scan, or PET scan. So both plans work the same way. If you have hospitals, surgeries, and imaging, you have a deductible. First plan is you owe $3,000, and then you owe nothing after the deductible. So catastrophically, no matter how many nights you're hospitalized, no matter how much surgery you have, no matter how many MRIs you have, you're basically not owing more than $3,000. On the other plan, it's $1,500. So what you guys have to consider is it worth paying more money? Look at the paycheck contribution online and see how much more money you're giving to Aetna to upgrade to go to the $1,500. For many of you that are not expecting hospitals and surgery, the $3,000 is probably a better plan, but this is your time to make your choice. Okay, so we're keeping those same plans, and you can take a peek at the little description that we've given. Okay. Your full benefit summary is located on the My Benefit Link portal, so I encourage you to download that as well. On the Aetna site, you can register when you get your ID number. You can see your claims, your explanation of benefits. They tell you who you owe if a claim is processed. And more importantly, you can look up a Find a Doctor, and I've given you little instructions on how to find Choice, the POS 2 network, and where to locate it on the Aetna site. Going on to the non-medical, so we'll call this Guardian. The company pays for $25,000 of life insurance for everybody, and the company also pays for single coverage for dental and vision. The company also pays for an employee assistance program sponsored by Guardian. You have the ability to buy more life insurance. And this is a little description that says Guardian says you can go online and you go through our portal and you will select up to $200,000 you'll be required to answer a form to complete called an evidence of insurability to see how healthy you are. And then Guardian makes a decision as to how much life insurance you can get. On our portal, there's a little drop down. Even though the company is paying for 25, you may want an additional 50 or 100 or 200,000 on your own. And my portal lets you select it, and it shows you how much will come out of your paycheck. So that's the voluntary life. A little description on the dental plan. It is a PPO. You can go in and out of network. You get a $1,500 maximum for everybody enrolled. So what that means is, for example, when you have things like your preventative care, and there's a little description here about what that is, Guardian pays 100%. You owe zero, and whatever they pay goes towards your bucket of $1,500. Once you're exhausted with the $1,500, you stop till December 31st, and then it refreshes for January 1. You get the $1,500 for every person enrolled. So if you're enrolling yourself, a dependent, and 2 kids, there's 4 of you. That's basically $6,000 worth of coverage, $1,500 for each of you. One point about dental is if you're going out of the network, keep in mind they're going to pay the same percentage that if you went to one of their dentists. However, they're going to pay 100, 80, and 50% of their rate. Chances are your dentist may not accept that and bill you more. So just be prepared that if you go out of the network, you may owe more, and that's just between you and your dentist. Try to stay in network when you can is the point. This is a little box to show you how to look up your dentist. Vision, eye injuries, medical conditions like glaucoma, those things are going to be covered under the medical coverage with Aetna. But if you're looking for routine, like an annual checkup or reimbursement for lenses, frames, and contacts, you need to buy a vision plan. Those things are not included in Aetna's medical. Excuse me. The network that Guardian uses is VSP, which is the largest national provider, vision provider in the country. When you go to your eye visit once a year, you'll pay a $10 copay. Guardian then pays the balance at 100%. When you're using a VSP provider to get like a pair of glasses, you'll have a copay for the lens. You'll get $130 cash plus 15% off. So I always tell people vision is sort of a combination of a copay, cash reimbursement, and a percentage off. And when possible, try to stick in the network for VSP. You'll have a maximum benefit if you go out of the network. VSP is a very large network, so most of you should be in network. And that's how you can look up your vision provider. Our portal, again, my benefit link, you'll see your name at the top right, the Brave Rings logo. You can update your profile, add dependents or not. Step 4 is sort of all the plans. Info button, by the way, will launch the full benefit summary. Compare plans, will put them side by side. You must click select and enroll to see the costs. And from there, you can darken the one you want, or you can sign the waiver. You have to click the select button for each of the plans and click next. You have to proceed to step 8 and sign. Otherwise, your election isn't done. Crystal and I will be monitoring the portal and just make sure everyone's wrapped up. On a calendar, we'd like open enrollment to be wrapped up on Friday the 10th. So we're given a week and a half for folks to get in and make their elections. So that's all I had. You're welcome to call me with questions, or Amanda and my support staff. We're going to monitor it and again, try to get all the elections in so we can have everything wrapped up for June. I thank you and have a great day.